On January 20th, newly inaugurated President Trump signed sweeping executive orders on health care that in many instances revoked or rescinded Biden administration orders. Experts say this represents a shift in priorities, not just from the Biden administration, but in some instances from the first Trump administration, especially when it comes to initiatives that contain cost or bring down the cost of prescription drugs. And in other instances, he reversed protections from discrimination. We're going to look at a couple executive orders, and the first impacts the Affordable Care Act. The Trump administration has rescinded a Biden administration order that extended the length of open enrollment and made more help available for more people trying to find a marketplace plan. He also rescinded an order designed to strengthen Medicaid. This comes on the heels of one of the most successful Affordable Care Act open enrollment periods ever. 24.2 million people made a plan selection during the most recent open enrollment period, thanks in part to some extra assistance, longer times to make those plan decisions, and enhanced premium tax credits. For now, those enhanced premium tax credits are safe. That's law. They run through 2025. We'll need an act of Congress, however, to extend them further. Let's look at the prescription drug coverage executive order. The Trump administration has stopped efforts to lower the price of prescription drugs for people on Medicare and Medicaid in advance of the second round of drug price negotiations. Right now, however, it appears that $35 cap on insulin is safe. However, the Trump administration has ended the drug pricing pilot program that was developing different experimental drug pricing models, and they have also stopped that $2 flat copay for generic drugs to treat chronic conditions. A couple other executive orders: pull the United States out of the World Health Organization, strip gender identity from federal policies and procedures, and allow for the arrest of people without legal residency in sensitive locations like schools, churches, and hospitals. Also, a pause on communications coming out of agencies, including the National Institute of Health, the CDC, and the National Science Foundation. So what's next? It's not clear. There were some actions in these executive orders that have been already challenged in the courts because they were some actions that could not be done by executive order. But it also just more generally signals some priorities of the administration, an intent to wipe away Biden administration programs to lower costs and expand coverage, but also causing some concern about what is next for uninsured Americans and the weakening of safety net protections for low-income people, especially people on Medicaid, Medicare, and food assistance programs. You can read more on those executive orders. We link to them in the description below.